The job description of a practice manager centers around overseeing the day-to-day operations of medical practices, dental clinics, or other healthcare facilities to ensure efficiency, compliance, and a high standard of patient care. Serving as the administrative backbone of healthcare establishments, practice managers are responsible for managing staff, maintaining regulatory standards, and ensuring that both patients and providers experience a streamlined professional environment. This role is vital to the sustainability and success of private practices, group practices, or community health centers. Practice managers operate in a unique intersection of healthcare and business administration. While physicians and clinical staff focus on medical treatment, practice managers handle the behind-the-scenes operations that enable healthcare providers to do their jobs effectively. Their primary objective is to manage the non-clinical aspects of a practice so that the quality of patient care remains high while business objectives are met. They may be responsible for financial management, human resources, compliance with healthcare regulations, vendor relations, scheduling, and patient satisfaction. In many ways, the role of a practice manager resembles that of a general manager in other industries, but with the added responsibility of navigating complex and often changing healthcare laws and standards. Practice managers must be adept at multitasking, problem-solving, and leading a team within the structured, high-stakes environment of medical services. As the healthcare landscape continues to evolve, with greater emphasis on technology, patient experience, and cost efficiency, the practice manager's role becomes increasingly strategic and dynamic. Key responsibilities of a practice manager. A central responsibility in the job description of a practice manager is operational oversight. This includes managing daily workflows such as patient scheduling, billing, insurance verification, and coordination among clinical and administrative staff. The practice manager ensures that the clinic runs efficiently, minimizing delays and optimizing the use of resources. They create operational procedures, monitor adherence to these protocols, and identify opportunities for process improvements. Staff management is another core aspect of the role. Practice managers are often responsible for recruiting, hiring, training, and supervising administrative personnel such as receptionists, billing specialists, and office coordinators. They may also be involved in performance reviews, team meetings, disciplinary actions, and staff development programs. In group practices, they may coordinate schedules for physicians, nurses, and technicians to ensure proper coverage. Financial administration is crucial in this role. Practice managers prepare budgets, manage expenses, oversee payroll, and ensure that the practice remains financially viable. They may handle accounts payable and receivable, negotiate contracts with suppliers or service providers, and monitor key financial metrics. Additionally, they ensure that billing processes are accurate and timely, and that insurance claims are filed correctly to avoid revenue loss. Compliance and risk management are also integral to the practice manager's duties. They are responsible for ensuring the clinic meets all healthcare regulations, including HIPAA, Health Insurance Portability and Accountability Act, in the U.S., infection control guidelines, labor laws, and safety standards. This involves updating policies, conducting internal audits, and staying abreast of regulatory changes. In the event of an inspection or accreditation visit, the practice manager plays a key role in preparing documentation and coordinating responses. Patient experience and satisfaction fall under the manager's purview as well. Practice managers monitor appointment wait times, service feedback, and complaint resolution processes. They may design patient satisfaction surveys, follow up on negative feedback, and implement service improvements based on patient input. Ensuring a welcoming, efficient, and respectful environment contributes to patient retention and reputation management. Technology management is another important aspect, especially as healthcare practices increasingly depend on electronic medical records, EMRs, practice management software, and telehealth platforms. Practice managers oversee the implementation and usage of these systems, train staff in their application, and liaise with IT vendors to resolve issues. They may also be involved in data security protocols and system upgrades. Halfway through analyzing these multifaceted responsibilities, it becomes clear that the job description of a practice manager is deeply rooted in a mix of healthcare expertise and business administration. From budgeting and staffing to patient service and compliance, practice managers serve as the linchpin that holds the clinical and administrative arms of a healthcare facility together. Their influence shapes the overall performance of the practice, both financially and operationally. Skills and competencies required for practice managers To effectively fulfill their duties, practice managers must possess a robust set of competencies spanning leadership, communication, organization, and technical know-how. Foremost among these is leadership and team management. Practice managers must be able to motivate and guide their teams, resolve conflicts, and foster a culture of collaboration and respect. They are expected to lead by example, balancing firmness with empathy. Organizational and multitasking abilities are essential. Practice managers often juggle competing priorities, such as handling a staff shortage while dealing with a billing error and preparing for a compliance audit. The ability to stay organized and focused under pressure directly impacts the smooth functioning of the practice. Financial acumen is vital for overseeing budgets, analyzing financial reports, and ensuring cost efficiency. A strong grasp of revenue cycle management, billing, coding, and insurance reimbursement is especially critical in ensuring financial health and sustainability. Communication skills are key, as practice managers interact with patients, staff, vendors, and healthcare providers. They must be able to convey policies, explain billing processes, and resolve disputes diplomatically. Whether in one-on-one conversations or staff meetings, clear and respectful communication helps maintain morale and operational clarity. Regulatory knowledge is another cornerstone of the role. Practice managers must stay informed about laws and regulations relevant to their practice, including licensing, data privacy, and clinical safety. This knowledge enables them to identify risks, develop policies, and maintain a compliant practice. Technical proficiency with healthcare management systems is expected. Practice managers should be comfortable working with EMRs, scheduling software, billing platforms, and other tools necessary for clinic operations. In some cases, they may also manage social media pages or the clinic's website, especially in smaller practices. Problem-solving and decision-making skills are constantly put to use. Whether handling a scheduling conflict, an IT outage, or an irate patient, practice managers must assess situations quickly and implement effective solutions without compromising care or efficiency. Emotional intelligence, including empathy, patience, and resilience, plays a big role in this people-centered position. Practice managers must support both staff and patients in an environment that can often be stressful, emotionally charged, and unpredictable. Work environment, challenges, and growth prospects. The work environment for practice managers is usually in outpatient clinics, physician offices, dental practices, or community healthcare centers. Their schedule is often aligned with clinic hours, typically full-time, although extended hours may be required during crises, transitions, or periods of high patient volume. Much of the work is carried out on-site, but remote administrative work is becoming increasingly common, especially with advancements in cloud-based systems. Challenges faced by practice managers include maintaining regulatory compliance amidst constant changes in healthcare laws, managing high patient expectations, and dealing with staff shortages or turnover. Balancing quality patient care with financial constraints is another recurring tension. Handling insurance denials, system outages, or unexpected emergencies can also add stress to the role. Despite the challenges, the career path for practice managers is promising. With experience and continued education, they may advance to senior roles, such as regional manager, operations director, or healthcare administrator. In larger healthcare networks or hospital systems, there are opportunities to manage multiple sites or departments. Those who pursue advanced degrees or certifications, such as Certified Medical Practice Executive, CMPE, or Fellow of the American College of Medical Practice Executives, FACMPE, may further distinguish themselves in the field. Education and training pathway. Most practice managers hold at least a bachelor's degree in healthcare administration, business management, public health, or a related field. Some enter the field with clinical backgrounds, such as nursing or allied health, and transition into management through on-the-job training and experience. Others pursue postgraduate qualifications, such as a master's in healthcare administration, MHA, or business administration, MBA, to deepen their knowledge and expand their career options. Certifications are not always mandatory, but can enhance a candidate's credibility. Professional credentials such as CMOM, Certified Medical Office Manager, CMPE, or HFMA's Certified Revenue Cycle Representative, CRCR, offer specialized knowledge in practice management, finance, and operations. On-the-job experience is highly valued, and many practice managers begin their careers as administrative assistants, billing coordinators, or office supervisors before progressing into leadership roles. Conclusion. The job description of a practice manager encapsulates a wide-ranging set of responsibilities that are essential to the functionality, sustainability, and success of any healthcare practice. From managing finances and compliance to leading staff and enhancing patient satisfaction, practice managers are the operational heartbeat of medical facilities. Their behind-the-scenes leadership ensures that doctors can focus on what they do best, providing care, while the practice thrives both administratively and financially. For those seeking a meaningful career that combines organizational skill, leadership, and a passion for healthcare, the role of a practice manager offers both challenge and reward. It is a position of responsibility, requiring a well-rounded professional who can adapt, lead, and deliver results in one of the most vital sectors of society. As healthcare continues to evolve, the role of the practice manager remains indispensable, both today and in the future.